Hi, my name is Rachel. I work as a registered nurse. Basically what I do, I come in at 7 o'clock and get a report on my patients. We do verbal reports. It takes about 30 to 45 minutes. And after that, we go and see our patients one by one, write our name on the board, introduce ourselves, assess them. We do basically specialized assessments on what they were diagnosed with and why they're here with us. And then if they have any complaints, concerns, they tell us then. And we have about 5 to 6 patients. Occasionally we have 7. And then we go and we'll pass meds on them. Our basic job here is to provide care for them and do their plan of care. And we are basically the patient's advocate. If there is anything wrong and we don't feel like it's addressed, then we will go to the doctors and advocate for them, because we are what they have, because the doctors are only here for a given amount of time a day. I do a lot of pain management. This is a renal floor and a diabetes floor, flu, pneumonia. So we dabble in a lot of everything. It is a 12 to 13 hour day. I work 3 days a week, and the biggest thing about nursing is to manage your time. You have a lot of patients and a lot of tasks to do, and you have to also think about how the patient is psychologically and mentally and emotionally, and still provide them with the optimum best care that you can. So stress can be high, but time management, if you're good at that, then your stress will be manageable. Well, I decided to be a nurse right outside of high school. I went straight to a community college and I got my prerequisites. It's a lot of science, a little bit of math, and then I transferred to a university and I got my bachelor's degree, so I have my BSN. Those last 2 years, when you're actually in nursing school, you'll go to clinicals every semester. They vary from 8 to 12 hours, and you learn how to care for patients. After I graduated from the university and I got my bachelor's, you usually take a review course, and it gets you ready for your boards, which is called the NCLEX. And you have to pass that exam in order to become a registered nurse. As far as skills needed to be a nurse, my number one is time management, of course. You have to be a sense of humor, basically, but being personable is number one. You have to deal with a lot of different people, and understand, be culturally acceptable, because everybody's different. And you need to be there physically and emotionally for that person, because being hospitalized is traumatic for any patient. The best part of nursing is probably exactly what I thought it would be. It's the rewards and the thankfulness that you get from the patients. Generally, they are so pleased to have someone to be there for them and to care for them. And I love seeing patients pull out of things and get better, and their families being supportive. It shows you how priceless life really is, and it makes me thankful for everything I have. The worst part of the job is probably not what I would have thought about at all younger, but you know, changing them, all the poop, and there's a lot of task work that you don't really think about. It's not just medicine and medical diagnoses. It's a lot of cleaning a patient, like caring for ultimately an adult baby sometimes. And you also get those occasional difficult patients that don't appreciate you, but the best definitely outweighs the worst parts of the job. My final advice to y'all is if you are looking into the nursing profession, definitely pursue it. It's rewarding, it's great. It's going to be hard, but if it's your dream, definitely follow it. The best way to get involved early is probably to volunteer at a hospital. Look into your dual enrollment programs. I know most high schools have it. You can get your prereqs knocked out of the way early and get into the nursing profession faster if that's what you choose to do.